And this morning, it's Dear Mr. President, but we're taking a line through towards healthcare. And people are saying something, dear Mr. President. This is aside from politics. The politicians and those that you surround yourself with will tell you a certain thing. They will spin a particular yarn to then be able to let you know that things are working. Those on the other side of the divide might tell you that things are not working just to kind of rile up emotions. Yeah. But you know who's going to tell you the truth? The people who walk into the doors of medical facilities and are turned away on a public holiday because their children cannot get healthcare. You know what they're told? They're told that, well, we don't work today, so maybe you need to find another facility. On going to another facility, a woman with her son is told, well, you know what? Unless you're paying cash, that card is no good here, or that status is no good here because we have not been paid. Facility after facility after facility. She's told this until she has to tell a friend who's told another friend to put it out in the public that she is unable to access healthcare. Meanwhile, she's all paid up. That's the reality.
Please repeat that statement again. She's all
paid up. So the people who are telling you the truth are the people who have to walk to the facilities. Dear Mr. President, the people who are telling you the truth is a man who talked to us in February, and he's a cancer patient. And he was in remission for a while, and then, unfortunately, his cancer came back. When he went back to hospital to then be able to access, he made sure that he was paid up until November. We're talking about November 2026, because he paid for a year. He went back to hospital in January and they told him, well, there's a problem here and we're not able to offer you the care that you need. For whatever reason, it was not attended to. So you know what he does, dear Mr. President? He goes to see his doctor. He lies about his symptoms so that he can get the least care that would then be prescribed for the least shillings that he has to spend. He doesn't tell the truth about how he's feeling. He doesn't tell the truth about what his real symptoms are. He doesn't tell the truth about the real state of his health. So that whatever medical care he will be given, he will just spend the money that he has on him that day so that, you know, he doesn't kick the bucket and that he just remains alive in order to make it happen. These are the stories. These are the people who will tell you the truth. Dear Mr. President, you surround yourself with people all the time who either will tell you one thing to remain on the good side of politics or will tell you another thing to kind of stick the finger in your eye. I repeat, the people who will tell you the truth are the people who have to walk through those doors. Teachers, there are about 400,000 in this country. Yep. They're responsible for teaching our children in schools. They've basically said to you that until you reinstitute the system that allowed them to go to a medical facility without having to pay out of their pocket again, they will not go back to teach. This is the real situation about healthcare in the country. Dear Mr. President, things are not looking too good. And your people want to talk to you this morning and tell you that 1, 2, 3 have to be in order. I had a browse through the charters of each county. Yep. And 32 out of 47 charters mention healthcare.
Healthcare, yeah.
32 out of 47 charters mention healthcare. Apart from that, there was an entire health charter. There were health professionals who came and sat, and they came up with what the healthcare system in the country was going to look like. And it is upon that you established SHA. The people who want to use it for political gain, I want you to ignore them for a minute, dear Mr. President. Listen to the people who are walking through the doors of medical facilities every hour in this country and are being turned back. The people who still have to go to their families to ask for money and their friends so that they can be treated. The people who are in Busia, 16 women who have children and are not released because of bills. These are the people who are talking to you this morning, dear Mr. President. They want to talk to you again.
You know, most of the time when you talk about what is to do with healthcare, at times it's good to just personalize it. And I'm going to do that. You remember when December, January, I had a problem with my eye, right? I went to hospital. I tried using SHA. Guess what? It did not work for me.
You.
I couldn't decide. I'm going to be honest here. You know, I was forced to use a private insurance card right? And even after that, every other month after that, I've had to buy medication for my eye. That is aside from the fact that as we speak right now, Mama went through a surgery. Did not work for me at that point. Mama has gone for 2 surgeries. Did not work for me. Every other checkup that is, she's going to hospital. She's not using SHA. We have to go deeper into our pockets. That is my personal story and many other Kenyans out there. So when we are told that SHA is working, that SHA is delivering, for who? Because for me, it did not. And not just me, for my parent, it did not. For the woman who's giving birth outside the hospital because they are unable to access that, it did not work for them, Mr. President. And you see, I was also just thinking about it the other day, and I don't understand how a cabinet secretary for health would come sell me the idea. The president will sell me the idea, the promise that SHA is working, yet themselves are not using that facility. It can be that we as Wananchi pay up for this insurance cover for all the 55 million Kenyans. But we have a cabal of individuals who are here selling us the promise over something that they are not using themselves. Mr. President, it can be. If you're selling me the promise of SHA, you have to be signee 001 on SHA as the person who uses that cover. Cabinet Secretary Duale, I'm going to call you out. You can't sell SHA for me that it's working, yet you are using a private insurance. No. You have to consume that which you're selling and giving a promise that it's working. It is only through that we will see this thing happen. Magufuli did it in Tanzania. What did he say? Every other public servant, whether you are a cabinet secretary, whoever you are, the hospital that you are selling to Wananchi is where you will go. And through that, hospitals started working and functioning because their lives were on the line. Can be that all of us, we were put into this basket to go access this healthcare, that themselves who are selling the promise can't stand behind that facility and use it. Can't be.
Can't be that you're selling something that you're not going to then be able to use. What is your situation this morning? Let's not sell propaganda. Let's talk about the real situation, and we'll do that with you today. Dear Mr. President, the state of healthcare, it doesn't look too good at the moment. 0732 142 653, 0732 142 650. Talk to us this morning. What is the case? Not what you've heard, what you've experienced, what you've seen. Yeah. You've been asked to put money aside by many groups. You've been asked, even if it is your 1 shilling, 5 shillings or 50, somebody's asked you to put some money aside because it's just not enough for people who are paid up. What's it going to take to fix this thing once and for all? And I'm asking a question. When folks were on NHIF, and guys, let's not be political here. Let's have a real conversation. When folks were on NHIF, did you experience this kind of uncomfortability with the system? Let's be honest. And if you did, say you did. Yeah. And we also understand that when something changes, you're going to hit a few bumps along the road. We get that as well. But there have been a number of bumps since October, when SHA was October the year before, when SHA was instituted. What are we looking at here? So let's talk this morning. Hello, good morning. Okay. Hello, good morning.
Good morning.
Good morning. How are you? Please tell us your name and where you're calling in from.
I'm calling from Kericho.
Yes, sir. What's your name?
I'm Mr. Duncan.
Yes, Duncan, please tell us, what is your experience with SHA working for you? Is everything okay?
I think it's a monster.
It's a monster?
Yeah.
How so?
When you go to hospital, you are being told that the SHA is not working with this part, and you have to pay half of it.
Duncan, you went to hospital and you were told that you had to pay a particular percent?
Exactly.
Okay.
Scanning like X-rays and other scanning are not working. Expensive medication.
So, Duncan, when you say that it's not working, essentially what you're saying is that for like scans and X-rays, you have to pay out of your pocket.
Exactly.
So that's what you mean by it's not working. So if
Yeah.
you use your SHA status, for example, they tell you no, for a scan, this X-ray, you have to pay. Medication,
Exactly.
SHA can take care of, but this other thing, no.
Yeah, exactly. No. Even you have to be inpatient so that they can pay partially.
You have to be an inpatient in order for it. So outpatient for SHA is you have to pay cash.
Exactly.
Oh, wow. Okay. Duncan, you're calling from Kericho, isn't it?
Yeah.
Yeah.
All right. Thank you for sharing this morning. So just to get a closure to that, by the time you went to hospital and came out, for you to get what you needed to do, you had to pay cash.
Exactly.
Okay. Are you paid up fully for SHA?
Yes, I paid for 1 year.
Paid up 1 year.
Yeah.
Yeah.
Okay, Duncan. Thank you for sharing. It's important to contribute to this conversation. Asante sana.
Thank you.
Let's take a number of your calls this morning. Just a reminder, the number is 0732 142 653, 0732 142 650. Hello, good morning.
Good morning.
Good morning. Please tell us your name and where you're calling in from, sir.
My name is Eric.
Yes, Eric.
From Nakuru.
From Nakuru. Talk to us.
Yes.
Tell us, what's your experience with SHA? Is everything okay? Eric? All right, let's take somebody else this morning. Hello, good morning.
Good morning, Duoko.
Yes, sir. How are you?
I'm very fine. This is Karaja from Naivasha.
Yes, Karaja from Naivasha. How have you been, sir?
I have been so fine.
Uh-huh.
I had been following you since I had been not been here for a very long time.
A very long time. Are you okay?
Yes, I normally listen to SpiceFM. It's my favorite station.
Kabisa, brother. Asante sana. Talk to us, Karaja. How are things going with SHA?
I think to me, SHA is another phenomena that need to be checked. Because I myself, each and every month, I deduct my pay slip is being deducted 850.
850.
850.
Okay.
Yes, salary. According to my salary,
Yeah.
I deducted 850. But SHA does not do anything. That's why for people is outpatient. If you go to hospital, you have to dig your pocket. Including maybe you have some homers, maybe you have some kind of ailment. You don't pay anything. They say unless you go and you have an inpatient, that's why they can even give you, but not a lot of money. Something so simple. Yes. Yes. I think SHA is a scam because to me it's a scam because if I compare SHA with the NHIF, with NHIF, if you are outpatient, inpatient, it was doing very well.
Okay. I hear what you're saying. So with NHIF, what you're saying here, inpatient, outpatient, you got treated. If you were paid up, you had everything, it was not a problem.
Yes, it was not a problem. If you go, but even if you go, you have the malaria, you have nothing, you have your dialysis, everything, you are paid with NHIF. But now with SHA, this is I think it's a problem. It's a grave national issue that it needs to be discussed. It's not discussed. People are going, watu wanaumia sana kwa sababu hii kitu haifanyi.
Nimesikia. Well, Karanja, asante sana. Thank you for calling in and sharing with us this morning. And of course, thank you for keeping on listening. But then to get your insights is very, very important. Asante.
Thank you very much, Duoko.
All right, Asante. All right, we'll hear from more of you this morning. It just seems like already we're going into it quite some. Hello, good morning.
Hello, good morning.
Good morning, sir. Please tell us your name and where you're calling from.
Okay, my name is Mohammed Rafiq. I'm calling from Transoya,
From
place called Amagoro.
It's called Magoro.
Amagoro, yes.
Amagoro, all right.
It is in Transoya.
On Transoya, okay. Tell us, Mohammed, how are things this morning?
I'm watching your program since a long time, and you have got a topic today of SHA. I'm also a patient of diabetes and heart problem.
Okay.
I've been attending SHA, and I've paid fully for 1 year.
You've been attending...
Since last year, I did not have any problem. But this year, in February, suddenly they started saying that, okay, your account is okay.
Mm.
They check you, they refer you to the doctors, the doctor gives you the prescription, and when you go to the pharmacy, they are saying, "Sir, it's mommy, Madawa, you have to buy cash."
Oh.
How can I buy cash when I don't have money for cash and I have already paid for 1 year? We don't understand what is this happening. Is it the SHA problem? Is it the hospital problem? Or is it the system's problem?
Mohammed, just to be clear here, you're paid up for SHA. Yeah. It was all right for you last year. So when you say it was all right last year, could you actually go to clinic and then for your diabetes medication, you could actually get the medication without paying? I mean, without paying extra. So this year from February, when you've gone for clinic, they've basically told you that for your medication, you had to pony up some cash. You wouldn't then be able to, okay. And so in order, of course, for you to get your medication, you have been paying cash.
Yes.
All right.
And why is it happening like that? They say something else and on the ground is something else.
I hear you.
Better I was a member of NHIF for so many years. We did not have any problem like that. Please.
Okay.
I don't know who's going to solve this problem.
But the thing is that for us to say it out loud that it is actually not, and if you know that the process that we're talking about right now is, dear Mr. President, that people can use politics and talk about it's working, it's not working, and throw back at each other. Okay. But the people who will tell the truth is Mohammed in Transoia, who says to us this morning, I go for my diabetes medication and I am told that SHA will not cover the payment for my medication. That's the truth. Do you understand what I'm saying? That's why it's important for you to call and contribute to this conversation.
Okay.
Mohammed, thank you. We keep talking about it. Let's see how we move the needle. Okay. Thank you. This is it, Dennis. So it's Tall who goes to the hospital to try and get SHA to sort out his eye. And that doesn't happen. It's Mohammed, it's Eric, it's Duncan, and there are more.
And you see, at that point when I went to hospital, I had a private insurance, but I was like, I also pay for SHA. I gave it out. And guess what the hospital said? We do not accept SHA here. You know why? Because we've not been paid. So if you don't have any other way, you have to use cash or use another insurance.
Ouch. Okay, let's hear if this is the story from others. Hello, good morning.
Good morning.
How are you, sir? Please tell us your name and where you're calling from.
I am Augustine Obundo.
Yes, Augustine.
Calling from Homa Bay.
From Homa Bay. All right. Talk to us, sir.
Yes. Now, I'm very happy to hear about the discussion, and I have the following to say.
Yes.
I'm sure the government knows that SHA is not working. For example, if you look at the payment itself, people are supposed to pay for about 3 months ahead, 6 months, or 1 year ahead. And this thing was meant for the poor. How are the poor going to get that amount instead of paying monthly as it was with the SHA, with the NHIF?
With NHIF, yeah.
But two, all the investigations like X-ray, or if you go for eyes, clinic, and the rest, you pay cash instead of SHA taking care of it.
Okay.
And more so, when you go to a referral hospital, which may be just next to your house, the SHA does not take care of that.
Okay.
So according to me, I see that that's a sham.
Okay.
And, yeah.
I hear what you're saying, Augustine. Thank you for that, because that then opens our eyes to certain realities this morning. Augustine, thank you so much for calling in this morning. And you see, this is why it's important to talk, D. You know why? Yeah. Because when we say SHA is not working, that doesn't mean that SHA doesn't exist. Yeah. What we are saying is that in the way in which it has been designed, you told people that they would walk into a medical facility based on the fact that their status has been maintained by the contributions they make, and they would not have to pay an extra coin from their pocket.
True.
The opposite is happening. So if 1 + 1 = 2, then SHA is not working. Thank you very much, Augustine. Let's hear from some others this morning. Asante Sana.
Thank you.
Thank you very much. The number is 0732142650 or 0732142653. Talk to us this morning. Hello, good morning.
Morning.
Good morning, sir. Please tell us your name and where you're calling from.
My name is Joseph.
Joseph, could you please turn down the volume on your radio so we can get you clear?
Okay, there you are.
Please tell us where you're calling from.
I'm calling from Nakuru.
Nakuru, all right. What's going on?
You mentioned something about the design of SHA that was supposed to work and somehow seems not to be working. And that is my point of figuring things out.
Okay.
Today, you walk to hospitals, and then not even hospitals, just in our backyard or relatives, people are struggling with a lot of pain, and I don't have to wait until I'm in pain for me actually to put an idea of how things should be.
Sure.
And my message would better be going actually to the implementer, the executors of the whole program. This thing can be fixed only if these people become sincere. One, if they were just to think salvaging their name, they must have buggered it out. But they can salvage their name by just doing only one thing. We are not supposed to be having only one service provider.
Okay.
The government is supposed to make up a model where it's supposed to be putting certain funds. And these funds are supposed to be on competitive basis. 1, 2, 5, 10 service providers.
Right.
It doesn't have, it might be regional, it can be scaled down actually to the level of hospitals, it can be blah, blah. Those operators, after they do the bidding, the government is supposed to be paying premiums directly to those actual service providers. And now we are going to have people, if at all you certain location, certain facility, automatically, this you're talking about paying about 500, 1,000, premiums 1,000. Your co-payment actually for that particular year is going actually to be going to the government, but you are going to be guaranteed. Now, why are we supposed to be having many providers? It brings competitiveness. In these service providers actually providing actually options for the people. It is also going to rule out actually so that people can get a fair value for money. That you're going to realize that if I'm not competitive enough, I'm not going to get the contract actually with the government. And then that allocation, the funding, the cabinet itself should figure it out. What is it that we need to mobilize?
Sure.
And which are those people we are supposed to target, for sure. We are not supposed to be saying everybody is supposed to be on SHA.
Okay.
People in a certain level of income, they are supposed to be enjoying facilities in the free market with alternative, and they are not supposed to be supported at all. The government cannot support everybody actually with this SHA business. We are only supposed to be having a certain population. Is it supposed to be about 30%, 20%? What Kenya is trying has never worked anywhere in this world. And that's when I know, I've been around the world, even though that it doesn't have it. So let's not try to do things that cannot work. That's my take. Yeah.
Thank you very much for that this morning. Of course, hearing from other people as well, but those insights are definitely some to be carried along. Asante sana. Hello, good morning. Hello, good morning. Hello. Hello, good morning. Please tell us your name and where you're calling from.
My name is Victor Misa.
Yes, Victor.
I am from Homa Bay.
Calling from Homa Bay. All right. Tell us, what's your experience? Is everything all right?
About the SHA, to me, I can say it clearly that it's not working.
Okay, why?
Because I myself, I went to Homa Bay Referral Hospital for a CT scan. Then when I went there, first they told me that when I was checking the child, it was for a CT scan for the child.
For a child, yes.
Yeah, and when I was trying to check my own card, and that is my own child, and when I'm trying to check the child, and they were trying to tell me that the name of the child is not in the card.
Okay.
So I didn't understand why the name is not in the card.
And you registered it?
I registered the child in the card.
Okay.
It was my card.
Okay.
So later they told me that I should give them some time to check up. But when they checked it, they came up again telling me that the SHA is not covering the CT scan. So I'm trying to ask myself which are the things that can be covered by SHA and how it is going to help the Mwananchi.
I hear you.
Yeah.
So perhaps they need to come out and say, this is what we are going to cover. This is how we are going to cover it. Instead of telling us that everything is going to work and then you get there and it's not working.
Yeah.
Because when these leaders, the president himself is coming out on the ground and telling people that the SHA is going to cover for everything, SHA is very inefficient for any treatment, anything. So when we go to a hospital like Homa Bay is the city hospital, the county hospital, the big hospital in Homa Bay County.
Yeah.
But if it can't work in Homa Bay level 4 hospital, where can it work in Homa Bay County?
That's the question. If it can't work at the level 4 hospital, which is the biggest, then where is it actually working? That's a good question.
Where can it work? Can it work in these health centers around here? So I don't know. To me, it's something like not working.
Victor, you're right.
Yeah.
Thank you. I'm curious, how did you eventually get the scan for your child? Did you have to pay cash?
Finally, I paid cash and I used 8,500 for the scan.
And how much is your cover in 1 year that you paid for?
My cover for 1 year is something like 570.
570 per month?
Per month.
All right. Okay.
Yeah.
Thank you for sharing. Thank you very much, Victor, for contributing to this conversation. We'll take a look at what some of you are saying on socials this morning, but I want to take a couple more calls before we do that. Just hearing the voices of the people. Hello, good morning. Hello, good morning.
Habari asubuhi mtangazaji.
Mzuri sana, salama, habari asubuhi.
Sabusa mzuri. Mimi naitwa Charles Muhula kutoka Siaya.
Kutoka Siaya, nilikuwa naomba tafadhali upunguze sauti ya redio tafadhali.
Sasa nipunguze sauti ya redio.
Asante.
Nimeshapunguza sauti ya redio.
Okay.
Swali niko nayo. Swali niko nayo ni rahisi sana. Unapata kwamba ule mtu anayolipa monthly payment ambao kama mimi ni 500. Ukienda hospitalini unaambiwa kwamba unaambiwa kitengo fulani huwezi SHA huwezi kafanya kazi, lazima ulipie kutoka kwa mfuko yako. Na tena ukienda hospitalini unaambiwa kwamba ulipe either halfly au ulipe yearly ndio baadaye utibiwe. Sasa swali langu ni hapa. Ule mtu ambaye amelipa nusu mwaka na mwaka mmoja mzima hawezi katibiwa na njia ambayo inatakikana. Lakini ule mtu pia ambaye analipa halfway pia unapata kwamba hatibiwi. So hii SHA inatibu mtu wa aina gani?
Inatibu nani? Ndio swali. Okay.
Inatibu nani? Kwa sababu ule mtu ambaye ukienda hospitalini unaambiwa kwamba haujalipa, unaambiwa ulipe nusu au ulipe 1 year. Ukishalipa 1 year unaambiwa for medication unatakana ufanye nini? Ulipe. SHA inakulipia hapa mpaka pale. Lakini ukirudi upande mwingine kama kama upande wa kansa. Upande wa kansa unaweza ambiwa kwamba unalipiwa kutoka mahali fulani mpaka mahali fulani, lakini SHA unaambiwa kwamba inalipa everything. Lakini ukienda kwa ground vitu ni tofauti. Mbona hiyo inafanyika hivyo? Asante Charles kutoka Siaya.
Asante sana Charles kutoka Siaya. One more call and looks like they're coming in heavy. Coming in. Good morning. Hello, good morning. Salama, habari asubuhi. Tafadhali utuambie jina lako na mahali unapigia kutoka wapi?
Na pia punguza sauti ya redio kidogo tu.
Na ongeza yako. Hello.
Napiga simu kutoka Arusha, Tanzania.
Kutoka Arusha, unaitwa nani sasa?
Naitwa Victor Bomera.
Victor.
Ndio.
Hebu tuambie.
Nimeona mjadala unaendelea KPL kuhusu SHA. Sasa mimi kwa kweli ninachojiuliza, mimi nilikuja kumpeleka mamangu hospitali. Nikampeleka Migori Hospital. Lakini cha kushangaza, nilikuwa nimelipa hiyo SHA kwa mwaka mzima. Lakini haifanyi kazi. Sasa mimi nikashindwa, hii SHA inatibu nani na inaacha nani?
Na wewe unafanya kazi Arusha?
Ndio.
Okay. Lakini ulikuwa umelipia mama mwaka mzima?
Nilikuwa nimelipia mama kwa mwaka mzima.
Okay.
Ndio.
So wakati ulimleta hospitali walikuambia aje? Walisema ulipe cash ndio atibiwe ama ilikuwa aje?
Nilikuwa nimesha kata hiyo SHA. Lakini wakaniambia system ifanye mpaka lazima nilipe cash. Ikabidi tena nilipe cash ndio mama atibiwe.
Okay. Hoi, all right. Asante sana kutuambia leo asubuhi. Asante. So it can't be.
You can't fake it.
That's everybody.
You can't fake it.
Okay, and this is a spectrum from across. Okay.
That call came from Tanzania.
For somebody who works in Tanzania, has come to Migori to treat his mother and is being told the same thing. You want to take a quick look at what's being said on socials in terms of who is saying what, where many more calls coming in. We'll take those in just a sec, guys. Hang on.
Yeah, so Meshakotin says, I went to Msabaha Healthcare in Kilifi County. The answer is SHA only pays for consultation fees, which is 2,000. So they will deduct 2,000 from your account for consultation, the medicine you buy. And we have Oni Katavi, who says, this is the biggest scam. I show up at the hospital with a broken ankle, but I had to wait until I could get enough money for the x-ray and getting the cast. It only covered consultation fees. And we have Smokey Msibandi who says SHA is set up to pay for a few and deprive many. There are these town halls being held about value for money in a room of about 100 people. Here, less than 10 people whose SHA covered it all. And we have Mariam Shuki who says the people know how SHA is important. They could have it mapema, and they say they are paramedic. And Eric Award says SHA was started to make money for the rich. It was never meant to benefit the regular Monanchi. It's working perfectly well for those that benefit it. And it's a lot to do.
I know.
It's
quite a lot.
It's quite a lot.
Yikes.
Unfortunately, it's not positive.
This is where we are.
It's not positive.
The calls keep coming in this morning, dear Mr. President. I told you at the beginning of this that you'll have folks who will be on your side and will trumpet the choir and say it's working, or those on the other hand who want to stick a finger in your eye and say it's not working. But these are the real stories, dear Mr. President. These are the people that you need to listen to. They're calling on 0732-142650, 0732-142653. Hello, good morning. Hello, good morning.
Good morning. How are you?
Very well, thank you. Please tell us your name and where you're calling in from.
My name is Gona.
Yes, Gona.
I'm calling from Kilifi County.
From Kilifi. Okay, please tell us, what's your experience?
What we are supposed to tell you and what we want to know exactly about SHA. We have been in NHIF and they were telling us when you come here, this amount will be catered for, the rest you will have to pay, depending on the type of disease you have. And mostly when you are admitted. That is what NHIF used to tell us. And we were comfortable with that.
Okay.
When you were transferred to SHA, things happened differently. You are told when you are paid for SHA, you go to the hospital, you will be cured, and you don't have to pay anything.
Okay.
Yeah, so when the doctors ask money from you, you can even take them to police.
Sure, this is true. This was said.
True.
Yes, yes.
Yeah. Now, what is not happening in the ground, we go to the hospitals. When we go to the hospitals, we were cured. We are given the bills. We are told SHA will pay this, and this you pay cash. You see now the difference.
Very different from what you were told. Okay.
From what we are told. So what we would like the government to tell us, you pay contributions for SHA, but when you go to the hospital, this amount of money will be deducted from your account. The rest you will have to pay. People will understand that. But if you are told you go, you will be cured, don't pay anything now, the problem comes.
I hear you. Well,
yeah, that is where the problem.
That's the problem, and that's the truth that you're facing. Gona Inkilifi, thank you for calling in this morning and sharing that experience. You're not alone on this. There are others who said the same thing, but that you've been able to confirm that. Asante Sana. Thank you so much. Let's hear from some others this morning. Hello, good morning.
Hello, this is Eric again. Eh?
Yes, Eric.
So,
hello.
Hello.
Yes, Eric. Go ahead, please.
Yeah. Okay. I was saying with NHIF, it used to pay for bed, especially when you have.
Hello.
It used to pay for bed alone.
Yes.
Yeah. NHIF.
Yes.
But now the other day, my nephew was involved in an accident. Akafunjika mguu.
Okay.
So bill ikakuja around 190,000.
Okay.
SHA ikalipa around 143.
143.
Yes, and we paid the other like 50,000. So to me, I think that is fair.
Okay.
NHIF, as for the outpatient, you cannot walk into a referral facility with a flu.
Yes, which you shouldn't actually.
You shouldn't.
Yeah, you shouldn't.
Yeah,
so
you shouldn't.
When you walk into a referral facility with a flu, you'll be charged. But when you walk into a level 2, 3, it's free.
Actually, you know what should happen? Exactly. When you go to a referral hospital with a flu, they shouldn't tell you that we can treat you and charge you. They should actually tell you to go back to your level 3, 2, or 1. They shouldn't actually agree to treat you. And this is why we are saying that the system then is flawed. Because the person who is accepting the treatment and demanding payment of you is actually doing so falsely. They should actually tell you, please go to your level 2, and they are 1, 2, 3, 4, 5 in the county. Or go to your level 3, they are 1, 2, 3, 4, 5.
Yes.
Yes, that's what they should do.
That is what should be happen. That's what should happen.
Yes.
Yeah, I agree.
Absolutely.
So, to me, we have the negative and the positive sides of this SHA program.
I hear you. Thank you for highlighting that. It is very important as well.
Yeah.
So for people to know, thank you very much, Eric. We'll take some other calls, but thanks for calling back. I mean, I'm just listening to what he's saying, Dennis.
Yeah.
People who are, and this is actually interesting, because people might walk to a level 4, level 5, level 6 hospital and say, Niko Dahoba.
Yeah.
And then they treat them. They treat them and charge them.
Yeah.
They should actually not treat you.
It should refer you back.
They should say, go to your level 2, and this is the list of level 2s in this area. Go here. Then you will not be charged. But by the very fact that they charge you to treat you for a flu is a problem as well.
And you see, this is where the problem as well is. Because you see, think of it this way. I live next to this level 5 or level 6.
Yeah.
It's the hospital that is closest to me. It is nearest to me. So when I'm sick, by default, I will run there, you know. But there is also the packaging of SHA that was sold to Wananchi. You know what I mean? So it is, people were not told where to go first. People do not understand where they need to start
This
from.
is it.
So all this information needs to be packaged so that by default, when Nikona Hoba, I know exactly where I'm going to, even if I'm closer to this level 6 or level 5. And for those doctors who are asking for money to treat someone who needs to go to a level 2 or level 3,
shame on you.
Shame on you.
Yeah.
Shame on you.
Yeah.
Because where is that money going to?
Where is it going to exactly? And if you're not supposed to actually receive it in that facility, so why are you asking for that money at that facility?
Yes.
I keep saying that the budget for communication is especially from government or actually any organization is usually in the least. For people to understand how this thing actually should work, save yourself the drama of people coming to tell you that the thing doesn't work. Why should people be going to a level? Why should somebody go to a level 6 hospital to get stitches?
Yeah.
Why should somebody go to a level 6 hospital to get malaria treatment or a test?
Now, guess what, Ndu?
No.
You'll also be surprised that the individuals who have gone to level 2, level 3 to get treated, but have not been treated because they do not have facilities to sort them out. So by default, what do? I went there before. I will go to level 6, where I know I will be attended to. So when you talk about SHA working, it is the entire ecosystem.
It is, absolutely.
Including communication.
Auntie Dr. Mercy Mwangangi.
Please.
Let me tell you something. Invest something in communication. It can be the ABCs of working with SHA. They have even given you that one for free. I won't charge you. Tell people how this thing works.
Yeah.
Because a lot of the mistakes that are being made, and people come to tell you that your system is fallible, is because they do not know, and your people are not telling them. There are too many calls coming in. Let's take some more of those.
Right.
But take my advice, please. Dennis has said something profound. Yeah. Come on. The communication that you're not giving people is actually adding to this problem.
Sure.
Hello, good morning. Hello, good morning.
Good morning to you.
How are you? Please tell us your name and where you're calling from.
I'm good. My name is David Mutisha. Niko hapa Imara Daima.
Hapa Imara Daima. Okay. Talk to us.
Yeah. Mimi nataka kuongea kuhusu mambo ya SHA. Wiki mbili nilivunjika mguu. Nikaenda hospitali. Nilipofika hospitali, jambo la kwanza waliangalia system zao, wakasema ita expire yangu wa mwezi wa 8.
Mwezi wa 8, so that's last month.
Mwezi wa 8.
Last year.
Oh no, it will expire
year.
August
it
this
will
year.
expire August this year, not that it expired. Okay.
Yeah. It will expire.
Okay.
So wakaniambia mpaka nilipe tena mpaka next year. Nika top up, nikalipa mpaka next year.
Wait. Sorry.
So you have to cover the
wakarudi wakaniambia tena niongeze 30,000 ambao sio za SHA, ni za hospitali.
Ndio wafanye nini?
Ndio sasa wanichukue, waniweke kwa kitanda, wanipime, wanifunge mguu ama wapasue. After all nilipa 30,000, nika top up SHA na 7,920, ndio nikachukuliwa, nikaanza matibabu.
So in short, you paid 37,920 for you to get assistance, yet ulikuwa umelipia.
Yeah, na hizo ni za pande hiyo. X-ray nikalipa cash. MRI nikalipa cash.
Okay.
Pesa za kufungwa mguu zile Pambed nikalipa cash 5,820.
Hospitali ulikuwa hospitali gani?
Inaitwa Jumuiya Hospital.
Okay. And you
private here.
Okay, so help me to understand. They said, okay, your cover is ending in August. Ilikuwa inaisha.
It's still active.
It's still active. Active cover inaisha August. Walisema top up. Uli top up na pesa ngapi?
Nili top up na 7,920.
7,920.
Yeah.
Okay.
Yeah.
Sasa hiyo ilikuwa active now, sasa times 2.
Paka next year.
So it's until next year. Ilikuwa when? This was when now?
It was on date 18 this month. Maana mimi najilipia, sifanyi kazi, nafanya jua kali.
April 18th. Now you have another. So you have 2 covers running concurrently. And so there's one until August. There's another one until April. Okay. Wacha hiyo. Walisema sasa pesa ya hospitali ulipe 30,000. Ndio nini ifanyike? Ndio uchukuliwe.
Sasa SHA wakasema SHA kuna kiasi ile watashiriki. Na kuna ile ninafaa nilipe kwa hospitali, maana they don't cover all the need amount.
Okay.
Ndio nikalipa 30,000.
Okay. Alafu ukalipa MRI tena.
Nikarudi nikatumwa kwa picture. Nikarudi nikatumwa kwa MRI.
Na saa yote mguu ilikuwa wapi?
Mguu iko kwa kitanda na sukumo na wale walinipeleka hospitali.
Okay.
Nikarudi nikaambiwa nilipie picha ya kupigwa moyo. Malamu anataka kuhakikisha sina shida lingine lolote. Nikarudi nikalipa pesa za kufungwa Pambed ya mguu liendelee kwa angalao wakingojea kunipeleka kwa upasuaji.
Okay.
So that day on 18 total amount nikija kutoka hospitali ilikuwa 81,000. Na pesa juu kidogo, angalau nikiangalia kwa kitabu ndio naweza jua. Ndio sasa nikatibiwa, nikalala kuanzia tarehe 18, nimetoka last Sunday but 1.
Okay.
David, I am so sorry.
So sorry. How are you doing now?
How are you doing?
Ninatulia kwa nyumba tena, nilianguka kwa nyumba za serikali affordable house. Hapo ndio nilianguka kwa gate. Niko kwa nyumba tu.
So you had an accident at work.
Kutoka kwa nyumba.
Affordable housing.
Not at work. I normally stay there.
Yeah.
Kwa hizo nyumba.
Or you stay there.
So kwa gate nikitoka kuna check plate waliweka pale barala staircase. So nilipokanyanga nikatereza kwa hiyo check plate. Mabati hii inakuanga kwa gari. Ndio hapo nilianguka nikavunjika mguu.
I'm so sorry, David. I'm sorry that you have to go through this. Okay. Thank you for giving your experience.
Yeah.
Thank you very much. Okay. And we pray for the ultimate healing for you and so that you can actually get back to work. Asante for calling in this morning and sharing that with us.
Okay, thank you.
Okay.
I'm so angry, man.
Beatrice is in Mombasa. Hello, Beatrice. Good morning.
Good morning. How are you?
Very well. How are you, sister?
Fine. I'm calling you from Mombasa.
Talk to us, Beatrice.
Now, my son has issue of bipolar.
Okay.
And now had to take him to Fortress Hospital. That's a county government hospital.
Fortress, yes.
Yes. And then when I was there, I was told my son's SHA is not active.
Okay.
They cannot admit him. I have to pay the whole year.
Okay.
So I paid the whole year.
Which was how much?
For him, I think he's not working.
Yes.
And when we went to register, it gave us 660 shillings
per month. Okay.
So that I was told to pay the whole year.
Okay, which comes to about 70-something hundred.
Yeah.
Yes.
Yeah.
So once I paid, he was admitted, and then he was discharged. Now there is monthly injection which he's supposed to go and get.
Okay.
Because he's not very good in medication, so the doctor prefer that awe anadungwa shindano kila mwezi.
Right.
So when I take him for monthly, now I'm told SHA cannot cover. I have to pay for injection, which is 2,500 on injection.
But you paid the 79.20 for the whole year.
Yes.
So, Beatrice, let me ask: when you got there, for you to access medication for your son, you had to pay the full amount so that you're able to access this medication, right?
An admission, because that time because they normally get violence, so we admit him. And now after hospital discharge, now there is that follow-up every month.
Okay.
So the follow-up is what you're being asked to now pay.
Yeah, I have to pay 2,500 for injection every month. And the medication, the tablet, always, there is no tablets in the hospital. No injection in the hospital. I have to buy the nearest chemist in the hospital. Naambiwa niende nje, nikanunua hizo tablet. Lakini shindano, naambiwa nilipe cash. Where? Iko shindano. But we don't know why am I told to pay cash. And then yakiandikiwa dawa, niende nearest chemist hapo nje, ninunulie kijana dawa. So I'm asking, what is the SHA inatumika wapi? And if I paid a whole year, kwa nini haiwezi cover my son? And this is the somebody to register. This is a jobless. He used to work, but now he's a jobless. And now, why am I buying the medicine? Why am I paying the injection every month?
Beatrice?
Like, if it's very violent, I have to pay 5,000 for the 2 injections. 5,000 cash. Hiyo lazima nilipe. So ikanifanya hata mimi nikajiuliza, why do I need to pay this?
For sure.
Because like 2 months ago I was admitted. Okay, I have a cover. I have an insurance cover. Then when I was discharged, because I went to theater, my bill came around 500,000. But when I went to pay to check, wale wakaniambia, wewe, you don't have a SHA. Because I stopped paying SHA because I wanted to see what will happen to this SHA. Then I asked, how much is the SHA paid? They calculated and say only 13,000. Out of 500,000, they will only pay 13,000. So I say, then I don't need to pay the SHA. So I can pay the 13,000. Mimi ninakulipia kitanda. Yani wewe unakaa hospitali for 1 week, bili yako imetoka $500,000. Alafu unaambiwa SHA itakulipia 13,000 peke yake. So huyo na wewe ukiangalia, mimi sasa nilipouliza watu wa SHA wananiambia mimi SHA I must pay 9,000 per month. So the government need to tell us how is this SHA working? And they tell us category. Kwa sababu unasikia kuna VIP SHA. Ati people working in the government, people working in the government wako na VIP. If me I'm paying 9,000 per month, am I supposed not to be a VIP patient also?
Indeed. These are questions.
Tuandike category. Waseme wewe ukilipa 500 wewe utalipiwa.
Tutakufanyia hivi na hivi.
Moja tutakufanyia kitu na hivi. Wewe ukilipa 5,000 utalipa. Hivyo category.
Hear you. Beatrice, I'm sorry, and we've had to say these words every day, almost every call. I'm sorry you had to go through this, and they continue to have to go through this. But one of the steps towards getting this is to speak out about them. So thank you for sharing with us this morning. We really do appreciate that. And we keep talking, and let's keep plugging in, my sister.
There are also many who've talked to us on the socials. Asanteni Sana, the poll was up. Is SHA cover working for you? 86% saying no, 14% saying yes.
Guys, why we have to have these conversations is that you cannot continue, number one, to suffer in silence, and if we're looking for solutions, they cannot be in silence. We continue to talk. You cannot be silent on some of these things. Dear Mr. President, it's the people who have to go through those walls who are telling you the situation. Our hope is that you can actually hear what they're saying. Good morning.
This is the Situation Room, the only way to start your day.